Hello, YouTube family and friends. Hope you had a great weekend. Hope you had enjoyed your 4th of July yesterday, and we'll continue to celebrate our independence this weekend. I had a decent week. I'm still on FMLA, recovering from my thymectomy. So I want to give you my weekly Mounjaro update and how my recovery is going, and update from after my Alaskan cruise. Today is Saturday, July 5th, 2025, and this is my week 67 results of being back on Mounjaro while dealing with a host of medical issues, including an autoimmune disease, generalized myasthenia gravis, which has affected my ability to lose weight. It's a muscle weakness, makes you really tired, yeah, and whatnot. That's why I have my thymectomy. If you know that, because you've seen my previous videos, right? So let me just start by my weight, because I didn't do a weigh-in last week because I was on the cruise ship. So let's see what it was today. Today I weighed in at 245. 2 weeks ago, pre-cruise, I weighed in at 242. So in 2 weeks, I gained 3 pounds, which isn't bad considering that I was on a cruise and I was pretty much inactive except for the walking around the cruise part thing. So as I recover from my thymectomy, they removed my thymus gland to potentially have a better future with this autoimmune disease. So I'm doing better from it. My breathing is better. I still get winded a little bit, not as bad as it was, and I can go through. I can be okay at times, but then, like as of right now, I feel a little winded, but it's not bad. So, but anyway, that puts my 67 weeks of being back on Mounjaro at a weight gain of 9 pounds. So, but like I said, if it wasn't for Mounjaro, I hate to see where my weight would be at, because I'm on a steroid treating the autoimmune disease. And steroids can make your diabetes, your A1C go high, which in return, on top of causing you fatigue and muscle weakness, it can greatly help you gain weight. So being at a 9 pound weight gain is not that bad considering how it could be. So I really do credit being on Mounjaro as saving me from being in the 300-pound range again, like I was a while ago. So yes, I would love to be able to start to lose weight again, and that's a possibility in the future. If this thymectomy, if this thymus gland was the main reason that triggered my autoimmune disease, my generalized myasthenia gravis, then I could have a better future. I just won't know for sure. Uh, the thoracic surgeon said, no, it could be 6 months to a year or longer before I see the positive effects of having my enlarged thymus gland removed. Thankfully there was no cancer in it, like I said in previous videos, but it was more enlarged than they thought it would be. So there is a good chance that it was causing my autoimmune. So, but we'll see. But having it removed can also make me at a higher risk for developing some of the other autoimmune diseases. It can also put me at a higher risk of developing cancer. And as you know, that I have a non-alcoholic fatty liver disease that turned into liver cirrhosis about 6.5 years ago. So I get scanned. I get an ultrasound every 6 months to monitor the liver, see how the scarring is, make sure there's no signs of cancer developing. No, I have a mildly enlarged spleen. I think it's mildly enlarged now, so it's gotten better. And I have a small varices in my esophagus, from the scarring of the liver. So we'll see. It's a lot. It is a lot. Of course, I'm type 2 diabetic. I have severe sleep apnea. That's why I got the Inspire plant, and I'm 3 weeks of using this, but I'm only on the second level, so I still have to use my CPAP machine, as you can see, when I sleep. I took it off last night. I think, according to the thing, I had almost 3 hours with it, and then I took it off. So I kind of vaguely remember taking it off. I think I remember taking it off, but there's some nights I take it off and I don't realize I'm taking it off. So that's the reason why I'm trying this Inspire device, is for that. So, by the way, so that's my update. My incisions are looking really, really good. Let's see if it's not bad to look at anymore. So let me see if I can get the. See there. See, it's looking good. That looks good. This is where the chest drainage tube was at. It's looking good. Under the breast is looking good. Now I'll be more happy once that's completely solid. Like these other ones are shrinking. So then you got one more back there. So the bruise is looking really good too. So yeah, my incisions are looking awesome right now. I have my 1 month follow-up with the thoracic surgeon next week on Wednesday the 9th. I also got my dentist, my 6-month cleaning, and on Monday, then on Tuesday I have my yearly eye exam, and then Wednesday I have my 1 month follow-up with the thoracic surgeon. So yeah, I'm still toying with making an appointment with a therapist, psychiatrist, whatever you want to call it, because I'm overwhelmed. I've been overwhelmed for quite a while with all my medical issues, on top of trying to learn a new job. I've been in my new role at my job since November, and due to 2 operations, doctor's appointments, vacation leave, and just the timing of it's hard to get time in to train with being an accountant. With the month end, we had year end, quarter ends. It's just really hard for my teammates to get time to train me. So as of right now, I'm only about 25-30% trained according to my teammates. I know that's putting a lot of pressure on them. They need to get that extra workload off of them and onto me. But yeah, so that's stressing me out. I'm overwhelmed with all my medical issues. I don't know if I'm making the right decisions, folks, between deciding to have this Inspire device implanted in me to making the decision to go forward with having the thymectomy, trying to keep track of all my different doctors, my appointments. I think I'm behind on my bladder, or not my bladder, my kidneys. I have a reminder that popped up on my CHI chart, my medical chart, saying I'm overdue for my kidney exam. It's overwhelming. And taking my vacation, that Alaskan cruise was nice. It got my mind off of most things. But as soon as I got back, even on the flight home, my mind just went off again. It's like, oh my God, what do I got to do next? Where am I at? When am I going to be able to go back to work? Is the thoracic surgeon going to give me okay, go back to work after the next week's appointment, or will she agree that I need a few more weeks? Just not even necessarily from the physical aspect of it, but from the mental aspect of it. It's just overwhelming. None of my medical issues at this time qualifies me for disability, but I feel overwhelmed. I'm overwhelmed, and it's affecting my ability to learn. I feel like I don't have the ability, the mental capacity to learn new things at my job. I feel overwhelmed. So I don't know. So I thought about seeing a therapist about it to see if it would be beneficial for me to take an extended leave, kind of going on short term at this point. I got plenty of sick leave built up. I still got, even after this 4 weeks off, I'm still going to have over 90 some days of sick leave built up, on top of like 18 days. No, actually, I'm at 20 days now of vacation leave built up. So if I extend my FMLA, which can run concurrent to short term, I'll still get a full paycheck for several months. Look at it looks like it's going that way. This one looks fine. That one, it's going that way. That's the autoimmune disease. Yeah. Anyway, enough of that. I was really hoping to make this video in less than 5 minutes, but I'm on 11 minutes already. I'm sorry, folks. I just can't make a short. I can't make a short video. So let me check my blood. I got my tester thing right here. So that just looks funky. My right eye. This is my right eye. It's just going that way. Like I said, the benefits of the surgeries, my symptoms of my autoimmune disease, I won't see anything for at least 6 months. That's what I've been told. I'm just wiping with alcohol wipe. Put my finger down low under my heart, try to get the blood flow, the blood built up in that fingertip. So, all right. That hurt. I hope if I put my test strip in, put my finger before I put the test strip in. All right, I got some blood built up there. All right, let's see if it's enough. Thank God, I didn't have too much more left. Okay, I'm fasting. I haven't ate anything yet. 95, it's consistently in the 90s, so that's good. Last week on the cruise, it was 96. So, yeah, consistently in the 90s, which is awesome. Thank you, Mounjaro. All right, that's the only thing I got left for you to do is my Mounjaro shot. And I'm putting my test strip and the alcohol wipe in this. I did stop taking Mestinon, the pyrodixtingmine. I sent a message to my neurologist saying the symptoms, I get the side effects of that, which is bad leg cramps, and I get the body tremors, especially in my hands. So he agreed that I get off of Mestinon again. I only went back on it for the surgery to make sure I didn't have, to help ensure that I didn't have a myasthenic crisis from the surgery or soon after the surgery. So, but I'm off. I stopped taking it again this last week. So, all right, Mounjaro 7.5. Take the protective cap off. Move it to unlock position. You can put it in the fatty part of your arm or your belly, at least 2 inches away from your belly button or your thigh. I'm going to do my belly. No, you can't see the plunger this time. I'm sorry, folks, but I'm not getting up. All right, here we go. Voila. It's in there. That's how easy it is to take the Mounjaro shot. You can't even feel it most of the time. So if you're afraid of needles, but you're interested in looking into Mounjaro or Ozempic, either one, but you don't think you can give yourself shots. I was the same way. I didn't think I could ever give myself a shot, but it's nothing. You can't feel it. After the first time, you're like, oh, this is nothing. So, all right, that's all I got for you, folks. Remember to enjoy life to the fullest. Don't work yourself to death. Be kind to everybody. And remember, it's okay to disagree. You don't have to agree with everybody on every subject. So, yeah, be kind. Enjoy your family and friends. Tell them you love them. And I love you all. You all have a good one. Bye-bye.